Career Connection is a national nonprofit that inspires and empowers the next generation of diverse health leaders and professionals, particularly those that want to serve underserved communities and be leaders in safety net settings. Health Career Connection has been around since 1990. It was founded in Northern California. And since that time, we have worked with college students that are from underrepresented and or low-income background to get exposure, experience, mentorship, and networking to choose and successfully pursue the health career that best suits them and to get jobs and to go on to graduate school and to become health leaders. And we have a particular priority focus through our partnership with CPCA on producing health leaders and professionals for community health centers. So Health Career Connection has over 3,000 alumni, and many of them have gone into administrative or policy roles in the health field, and many have gone into clinical roles such as physicians, nurse practitioners, physician assistants, pharmacists, and other needed professionals. And many of them got their initial start through our internship in community health centers. Very exciting that some of them are actually people whose families receive care from community health centers, and our real focus is having students from local communities get the opportunities to work in health centers and other health provider organizations within their own communities so that they can see that it's possible for them to give back to their community in that way and to meet our future health workforce needs. And so we place students all throughout in health centers all throughout California. HCC is in Northern California, Central California, Southern California, the Coachella Valley, the San Diego area. And we also place students in health centers in our other regions around the country.
So because it's a summer job, although they're full-time, we give them discrete projects that they can complete within the summer. And so they're often projects that we'd like to do, but often the existing staff are overwhelmed with day-to-day operations and don't get to. So some of them are like research projects around data, writing certain kinds of reports. But the big thing that they do is when we have the National Community Health Center Week, all the HCC interns really provide a lot of the hands-on for those events and are very helpful in recruiting people from the community, doing publicity, and preparing for those events for us.
It's very important, I think, for us as community health centers to use the HCC program as a workforce pipeline. It's an opportunity for us to engage individuals interested in healthcare and giving them a great experience to consider coming back to work with us. You know, I started in this program over 10 years ago, and I still keep in touch with my interns. Whenever there's an opportunity for a new job or a new project, it's wonderful to be able to reach out to those individuals to fill those positions.
Well, I think the biggest takeaway was it kind of solidified what I wanted to do in my career. I had the opportunity to also do an internship at a local hospital there in Long Beach as part of my HCA program. And I was almost tempted to stay there in Long Beach because, of course, it's the beach, so it's hard to get away from that. But it really brought me back down to my roots, and I did the internship here in Bakersfield, California. And again, just reemphasized my drive and my passion to come back and serve this population that, again, I had seen that there was such a need to improve the care that was being provided and be an influence in that sense.
It students who are bright-eyed and bushy-tailed and full of enthusiasm and desire to learn it improves the positive ions and the attitude of everyone around to it. Sometimes, we can get a little jaded with day-to-day, and they're really, the rest of the staff get along with them really well, appreciate so much. It's so great to be around folks who, for the first time, are seeing real healthcare delivery rather than just imagining it or reading about it in school, and their feedback and perspective makes us appreciate the work that we're doing because, like I said, we sometimes get worn down by, lack of resources and the challenges that we face and, the difficulty in delivering care, and our patients have so many challenges as well that it can be discouraging especially when the economy is not doing well. And they come on board, and they're happy, they're helpful, they just want to, do a great job, and it makes everyone feel good to have them around and have someone that can help share the burden of our work.